Hello, my name is ABienvenu, and today we're going to talk about intravenous therapy. This is the last video, the principles of safe intravenous medication administration. Um, we will, this video is going to talk about the nursing responsibilities, what exactly IV intravenous therapy is, the routes, like the different types. You'll see what I'm saying in a few seconds. The safety of it, and as well as the reason we chose IV versus a different route. Okay, first, there's three different types, three different methods of intravenous medications. There's an IV bolus. There is a piggyback, which means it's an intermittent infusion. Um, there's also a continuous infusion, which is a large volume of solution just over time that you can administer, say like a normal saline, 100 milliliters an hour. That's what that one is referring to. Um, there's responsibility. Basically, you want to make sure that you're supporting positive outcomes. You want to reduce any risk of adverse events. You want to make sure that the medication administration into the patient's plan of care. So you want to make sure to identify things that could potentially go wrong. You want to make sure that you educate your family as well as your patient as well as the family the reason why this patient is receiving IV versus a different route. And a little later on, we'll just get into the detail of those. The basic safety. I say basic, but it's really important. You need to know the 6 rights of medication administration before moving forward. And any of these, anytime you give a patient medication, regardless it's IVPO, anytime you need to reflect on these 6 rights of medication administration. And the first is right patient. Check their armband, get them to state their first and last name. Make sure that that patient is who they are. You don't want to give the wrong medication to the wrong patient. That because they may castrate into whole different events, and it may take someone's life. So it's really important to follow these steps exactly. Make sure it's the right dose, the right route, right time, and also document that you gave that medication so to prevent errors in the future. Check your medication more at least 3 times. Okay, you want to do prior to administration. You want to do as you're preparing the medication, and then at the bedside again. You want to check. You can't check enough. You have to just make sure we're promoting safety here, so that's really important. And only administer medications you prepare. Don't take nobody's word unless it's the pharmacist or the pharmacy technician delivering it to you. Then you double check the outside routes and make sure it's the correct dose and the correct patient and all that. But the actual administration, if someone made something in the med room, said, "Hey, here's this, well, thanks, but I can't use that. That's my license on the line." So make sure that the licensed pharmacist and if the technician hands it to you, anything from pharmacy, but it has to be the licensed pharmacist, only person that you could take. Make sure for your sake, make sure that the calculation the dose is calculated correctly. This is a double check because maybe the pharmacist made an error, and it happens. So the next thing is we were talking about why this route versus a different route. Well, maybe this patient is unwilling or unable to swallow PO. Maybe this drug, maybe the digestive enzymes in your stomach, when you swallow it, inhibits something in the drug. Maybe it would irritate the GI. If there's a GI bleed, then you don't want to give a drug to irritate it more to the GI. Maybe this drug is a sedative for surgery and it needs to be faster. It needs to be now. So you're not going to give them a PO or they start to wake up in surgery. You don't give them a PO there. They're sleeping. You have to use that route to make it go faster. It's the most accurate and precise dose, because if a patient swallows it, it could be the body may metastasize it in different areas. There's so many different things to get to the bloodstream. This here is straight in, and it's the most effective and fastest route out of all of them. Again, it really depends on the situation. If it's an emergency situation, I keep saying IV is the route because it's immediately now. Excuse me. Again, teach the patient these reasons they're having an IV, and because it is discomfort, and educate them as well. This is another important thing. Educate them that there is no needle in them. It doesn't stay in them. It's there to enter the vein, but it doesn't stay in them. A lot of patients think there's this metal needle in their arm for the stay of the hospital. Educate them that it is a plastic catheter in them, and that also we need to educate them on signs and symptoms if something's not right with the medication. If it's burning, if it's pain there, itching, swelling, this could be a potential risk for an adverse reaction with the medication. So there's a lot of patient education into this one here, and we just got to make sure that this is the right dose, right route. Those 6 factors that play into this. Does it need to be broke down more? Does it need to be diluted more? All these things are in your drug books. Make sure you reflect on it and stay up to date with things. Things change overnight with medications. So just ensure that you're up to date with all the current policies, and that is everything with IV medication administration. Thank you for watching, and that is it.